Hello everyone, you're watching sqadia.com and my name is Dr. Hamad. Today our lecture topic is rheumatoid arthritis. Have you ever wondered if a woman aged around 30-40 comes to you in your clinic with some deformity of hand or disfigured hand, what would be the first thing which would come into your mind? Probably rheumatoid arthritis, isn't it? Today our lecture topic is rheumatoid arthritis, and we'll be first discussing the overview, the general aspects. Then we'll be going through the epidemiology and its causes, what causes these symptoms to develop, and what are the factors which play the role in development of rheumatoid arthritis. Then we'll be going through the pathology, that is the pathogenesis of rheumatoid arthritis, and how the actually stages progress through what is the natural history of disease and how the disease progress from first stage to the last stage. And then as we know that rheumatoid arthritis not only affects the joints, but it also affects other organs as well. So we will be briefly discussing the extra articular manifestation of rheumatoid arthritis. Then we will coming up to the clinical features. When a patient, usually female, comes to your clinic, what are the symptoms, what is her history, and what are the signs which we need to elicit to make a proper diagnosis, and what differentials you need to consider when making a diagnosis. Once we have done the history and examination, we'll be going towards the investigation, because once a differential is in our mind, we will be looking to rule out other causes and make the right diagnosis. And that would include the lab workup, that would include some x-rays and radiology, and we'll be briefly discussing what x-rays needs to be done to confirm the diagnosis of rheumatoid arthritis. Then we're moving towards the treatment. Once we know that we have ruled out the other differentials, we have made the right diagnosis, then probably we'll have to move towards the principles of the medical and surgical management of rheumatoid arthritis. In the last section, we'll be going through the clinical practice guidelines. And why this is important nowadays, these rheumatoid arthritis, ankylosing spondylitis, cavities are very common. And American College of Rheumatology issues guidelines every 2 to 3 years. And the guidelines are basically needed because, as we know, that the rheumatoid arthritis treatment is now a multimodality treatment. There's a rheumatologist involved, there's an orthopedic surgeon, there's a physiotherapist, there's an orthotist who is involved at times. So these guidelines are actually responsible so that each one of us knows that what is his or her role in the management of the patient of a rheumatoid arthritis. Orthopedic surgeon knows his or her role, rheumatologist should know his or her role, and similarly, orthotist needs to know that when he or she needs to step in to help a patient with rheumatoid arthritis. Thank you very much. Keep watching sqadia.com.